Hello, everybody. Hello. So, I'm going to go ahead and get started. People can join in. My name is Brooke. I am the nurse practitioner from Port St. Lucie Medical Wellness. If I have not met you, or if you have not been here before, welcome. Every Monday I come on here and I do a live. I kind of go over some of our specials that we're having, and then, hey, my Aunt Michelle's here. And then I go over some specials, and then I'll cover a brief medical topic or an aesthetics topic, wellness topic, something like that, just to kind of give people some more information on things that maybe the doctor doesn't sit down with you and go over thoroughly enough. We are located in Port St. Lucie. We're off of Port St. Lucie Boulevard. It's 702 Southwest Port St. Lucie Boulevard, just between Gatlin and the Turnpike. So this month's specials, we do specials every month. So this month's specials is a dermaplane, which is a facial. So it's a mechanical facial, meaning we're using some kind of instrument to give you exfoliation. So this is with a scalpel. It sounds terrifying, but Michelle's very good. She won't cut you. And she just kind of scrapes the scalpel across the skin. I'm sure you've seen it on TikTok and stuff like that. But it's a mechanical exfoliation, so it gets rid of all this top layer of dead skin cells, fine hairs. It's something that's really good to do if you have an event coming up, because afterwards your skin is really smooth and glowy, and it when you put makeup on, it sets very nice and pretty. So regularly that's $120, and this month we have a special for $45. So that's a pretty good deal. It's about an hour-long treatment. She does a regular facial with it, and then the dermaplaning on top of that. The next one we did an anti-aging package. So that is a anti-aging facial. So Michelle has named it Rage Against the Age. So it's a regular facial, a nice relaxing facial, hydrating facial, with some massage and stuff like that. Takes about 45 minutes, an hour. And then in that package, you get peptide. The peptide we're going to give you is NAD. So NAD is a peptide that our body produces naturally. As we age, we produce less and less. NAD is responsible for how the cells age. So when cells reproduce, they produce nice new healthy cells in theory. As we age, those cells are not as healthy as they used to be. So a couple things happen with that. They are not producing the energy that they used to produce, and they are also living longer than they're supposed to live. So when cells reproduce, they have a cell life on them, and usually they know when they're supposed to die. It's called apoptosis. So that's pre-programmed cell death. So like a red blood cell knows it's only supposed to live for 120 days, and then it dies. If the cell stays around longer than that, it is what we call cells that are in senescence. So basically they're just useless cells hanging around. Those cells will start to create or hold on to oxidation. So you hear everybody saying like fight oxidation and ROS. That's what they're talking about. This oxidation can build up in your system, and it can lead to all kinds of other stuff. So NAD works on the cellular level to reproduce cells that are healthy, that know when they're supposed to die, that the DNA strands in the cell have been replicated appropriately. And it works in the mitochondria of the cell, which is what we call like the powerhouse of the cell, or where the energy comes from. So the mitochondria is where the cell produces, it's called ATP, which is what gives us energy. So when the mitochondria are functioning better, then you feel better. So it gives you energy. It also has tons of anti-aging properties. Usually you do it's an injection. So it's a subcutaneous injection, tiny little needle. We start with 1 injection twice a week, and you can do it, like, in the back of the arm and that little subcutaneous. Most people do it in their belly, and you do it in the morning because it usually gives you a good amount of energy, which is good. Sometimes when people first take their first injection, you can have kind of a weird it's not a weird response, but it's common. Liam, stop doing that because it's messing me up. So, you can have like uh it's like a niacin flush response. If you've ever taken niacin, which is a B vitamin, some people take it for blood pressure, for instance. When you take a niacin that doesn't have like uh, what is it? Extended release niacin. So all of a sudden your body is hit with all this niacin. It causes vasodilation, meaning all the blood vessels dilate. So you get like this flushing feeling. You get a little red, you get warm, your blood pressure can drop a little bit. And so when your blood pressure drops, you have a offset to that, which is increased heart rate. So your heart is trying to catch up and get your blood pressure back up so your heart rate can elevate. So you feel that flushing warmth feeling, you feel a little bit of the heart racing. It's transitory, usually lasts about 10 seconds, and then it's gone. It's totally fine, it's totally normal. It doesn't happen to everybody, but it does happen to some people. And usually after you do a couple injections, it doesn't happen anymore. So that kind of, once you get used to it, it kind of stops happening to you. But that's totally normal. So we do 1 NAD injection twice a week, and in that package, you're gonna get 8 weeks worth. So it's gonna be 2 months worth. So is that right? 2, 4. No, I'm sorry, 1 month worth. So it's 8 NAD injections, so 2 injections for each week. So regularly, those two are $170, and the special is 50% off, so it's 85 bucks. Um, Most people who start NAD, they continue with it just because it really gives you a good boost of energy. As soon as that kind of flushing feeling goes away and your heart kind of calms down, you just feel good. It's kind of hard to explain. You're not like it's not like caffeine, like jitters, and you feel weird or anything like that. You just feel good. You have mental clarity. You have energy. You feel like how you should feel when your body is making enough NAD. The next thing we have is a hydrodermabrasion. Again, this is another mechanical exfoliation. It's done with the hydrodermabrasion machine, which is like a water machine. It's got a diamond tip nozzle on it, so it exfoliates, and as it's doing that, the water is kind of shooting onto your skin, and it's sucking also at the same time. So that's where the exfoliation comes. It kind of sucks all that dead skin off. If you have blackheads, a lot of blackheads or congestion, it's going to suck all that out. Um, at the end, all the water that she used goes into this little jar, and you can look at it and see all the gross crap that was stuck in your face. It's kind of gross, but it's also kind of cool to look at. So originally, well, that's 50% off. So for that 50% off, it's $118.50. And that's another about hour-long service. It's a nice facial with the hydrodermabrasion and then some moisturizing treatments and blue light therapy and stuff like that afterwards. The last one we have is for Xeomin. So Xeomin is a neurotoxin. Very similar to Botox. Some people say it's Botox's cousin. So it's very similar with Botox. However, it is filtered differently. So if somebody has autoimmune conditions like lupus, MS, RA, something like that, I prefer to use Xeomin. The way Xeomin is filtered, it's filtered more times with a finer filter than some of the other ones. And sorry, we got a new kitty. She's making trouble right now. So it's filtered with a finer filter more times than some of the other ones. So some of the other ones have the neurotoxin molecule, but then also attached to that, they have proteins that are attached to it, which is fine. But if you have an autoimmune condition, then you've got to be cognizant of those proteins because they can cause a flare-up of that autoimmune condition. So by me using Xeomin, yeah, well, Diane says, need to see you soon. Wrinkles coming back. Just come over because I have some at the house. She's my neighbor. Um, so by using Xeomin, which is cleaner, it doesn't have those proteins, it's just the neurotoxin molecule. The chance of me triggering this inflammatory process is like pretty much zero with Xeomin. So I like to use Xeomin for those kinds of patients. If you're a patient who's been using Botox or Dysport or Jeuveau or something like that for a long period of time and you've developed a resistance, what you've developed is antibodies. The antibodies are to the proteins attached to the neurotoxin molecule, not to the neurotoxin. So if you switch to Xeomin, none of those proteins are there and the toxin will work for you again and you'll be wrinkle-free again. So we have 20 units. The first 20 units are $7.50 a unit, and that's regularly $9 a unit. So that's all the specials we have for July. I thought the topic I might talk about today, kind of piggybacking off of the topic last week, I wanted to talk about elevated blood sugar levels. So when you're diabetic, your blood sugar rises, right? And that can be because you're not producing insulin, you're not producing enough insulin, or you become insulin resistant. So a lot of those things can happen just as we age. A lot of things that cause that is like weight gain, not eating right, not exercising. That contributes to insulin resistance. So what is insulin? Insulin is the enzyme that your pancreas produces in response to when you eat. So when you eat, your pancreas is really smart and it says, okay, I ate this amount of food, so I need to push out this amount of insulin so we can utilize that food, the cells can utilize that food as energy. So it pushes out that insulin. Insulin goes into the bloodstream and attaches to the cells. It's like a key to the door to the cells to open the door to let the food, the energy come in. So now these cells can utilize that food as energy. What happens when we become insulin resistant is the key to the cell doesn't work anymore. So now we have a buildup of sugar in our bloodstream and we are unable to use it. So the cells they can't use that food as energy. So now they think they're starving. So when they can't get food, they can't get any energy, they tell you, I'm starving, and they tell your body, I'm starving, which means your body is going to take all that excess sugar and store it away as fat. So it's stored energy for later because it thinks it's not eating. So it needs to store this food away so it has energy for later. So that kind of becomes this perpetual cycle with diabetics. So doctors, in response to that, say, oh, well, let's give you insulin, right? So that doesn't fix the problem. Insulin just floods your body with insulin in the hopes that it will work on the cells. But if you're insulin resistant, it's not going to work. It will bring your blood sugar down, right? Because it is going to work to some degree on those cells because we're just flooding the body with insulin. But it's not going to solve the problem, which is the insulin resistance, right? So basically, you take insulin, it lowers your blood sugar, and now your blood sugar is low, so you can eat again, right? But now the cells, they think they're starving, so they pack that away as fat. And then you give yourself more insulin to cover the meal you made, and then you're hungry again, and then it's like this vicious cycle. So insulin is necessary for some people, but early on in the disease, there are things you can do to get back, get back that insulin tolerance so that the insulin is working. So all that to say that that is how your blood sugar rises in the body. So when your blood sugar rises, it has a similar effect on your blood vessels that a high blood pressure would have on your blood vessels. So it causes inflammation within the vascular system. So that high sugar causes a bunch of inflammation. And when that's in your arteries and veins, they get inflamed and they kind of form like a scar tissue. So they get inflamed, it's called atherosclerosis, right? So that's a hardening of the arteries. So when the arteries are good and healthy, when your heart pumps, the arteries expand and contract with the contraction of the heart, right? And that's what keeps your good blood pressure. But when you have high blood sugar and that inflammation or high blood pressure, that constant stress on the artery because of the pressure causes those arteries to harden. And so now when your heart beats, there's no give in there. So the arteries harden. And then when they can't stretch like that, your internal organs that need blood and oxygen to survive aren't able to get enough. And so, in response to that, your kidneys in specific will tell your heart that I'm not getting any blood. And you need your kidneys to filter out blood. So when they are deprived of blood, they aren't able to make urine appropriately. And they tell your heart, increase the blood pressure because I'm not getting enough blood. So now the blood pressure increases, and that's why a lot of times you'll see these diseases go hand in hand. So if somebody's diabetic, a lot of times they have hypertension. And that's just because of the effect on the blood vessels. So when somebody says, "What's the big deal? My blood sugar is high." That's the big deal. So the arteries harden, and this happens everywhere in your body. It happens in your brain, it happens around your heart, your kidneys, your lungs, your liver, everything. So everything gets deprived of the blood, the nutrients that it needs, and it takes a toll on your body. When the kidneys are not filtering the blood that they need to filter, then toxins can start rising in your body. So what we usually look at as doctors, we look at it's called a GFR. So that's a glomerular filtration rate. Glomeruli are in the kidneys, and there are little tiny things in there that filter the blood. But when we look at GFR, so the glomerular filtration rate, we're looking at how many liters of blood per minute is going through the kidneys. So we like for it to be above 60. When you start to get below 60, then we start talking about, oh, you having kidney damage, right? Another thing we look at is your BUN and your creatinine. So creatinine is another marker of kidney disease or kidney failure. So when this starts getting elevated, a lot of times anything like over 1.5, 1.7, then this is how we kind of rate the kidney failure that you're in. So there's grades 1 through 4. Anywhere from 3 to 4, you're looking at the possibility of dialysis, which is basically a machine that they hook you to 3 times a week that functions as your kidneys. So now you get, one tube that's from the arteries, one tube that is to the veins, and it goes through that machine. It filters it for you and pumps it back in your body clean. So that's great, but it's 3 times a week. It's about 4 hours every time. Most people on dialysis will do it for about 5 years before they get tired of it. It's exhausting. Many complications can arise from that, from drastic drop in blood pressure because they're taking all this volume of blood out of you at one time. It can cause massive infections because they're accessing your arteries and your veins 3 times a week. So that just increases the risk of exposure to bacteria through the arteries and veins. And when you get an infection in there, it's bad news bears. So the other thing you can get is air embolisms. So if there's an air bubble in there in the artery, or if it's not hooked in right, or something's loose and air is coming in, then it's basically like just the same as if you were to have a heart attack from like a cholesterol clot or a blood clot. That air is going to act just like a clot, and you can have a heart attack, you can have a stroke. You're got to be on blood thinners to go through the machine. It's something you don't want to do. Let's put it that way. You don't want to be on dialysis. So if you're looking at the GFR, your BUN and creatinine, and you're noticing those things are starting to go up, then we need to ask, why are they going up? Are they going up because of your blood sugar? Are they going up because of your blood pressure? Or, there's genetic issues that cause kidney disease, those kinds of things. So that needs to be checked into to find the cause of why that is going up. Most often, it can be something that you can fix. either by diet, medications like semaglutide, tirzepatide, cagrilintide, rotruitide, those kinds of things. Those all reset that insulin resistance. So now the insulin that your pancreas produces is actually working again. Um, so that being said, that's why we call high blood sugar and high blood pressure are like silent killers. So that's why we call it that, because you generally do not know that your blood sugar is high unless it is so high that it is basically you go into ketosis and you end up being hospitalized because the blood sugar is just too high and your body can't function. Blood pressure, same thing. You don't just wake up one day and you have high blood pressure. My blood pressure is normally like 90 over 60. So if I woke up tomorrow and it was 150 over 100, I would feel like shit. I would have a headache. I might be dizzy. I might be short of breath. I would have a lot of things because it's an acute raise in the blood pressure. But when your blood pressure is elevated and you have hypertension, that's usually an insidious onset. So your blood pressure isn't just raising like crazy one day, it's slowly raising with time. So you feel fine. Um, and actually, the opposite happens. So if you have high blood pressure and now we start to treat it, if it's very high, we have to treat it slowly to bring the blood pressure down. Otherwise, you will feel like shit because you're used to it being high. So you'll have dizziness, shortness of breath, right? Because now you're used to this elevated blood pressure and now it's coming down. And so your body has to kind of recalibrate to the normal blood pressure. But again, it's called a silent killer because you can't feel it. People will say, like, what's the big deal? I feel fine. You feel fine until you don't. You feel fine until those sclerotic arteries either burst and you have a stroke, ischemic stroke, you can have a clot, or a bleeding stroke in the brain. So you feel fine until you don't, until that happens and you end up in the hospital. So that's why it's important to get your regular checkups. You can go to the grocery store and get your blood pressure checked. There's for free all over the place. You can come to me and I'll check your blood pressure. Totally fine. I won't charge you. So if your family has diabetes like running in it, then I suggest when you're about 30, when you get your blood work done, you get what's called a hemoglobin A1C conducted. The hemoglobin A1C is kind of a snapshot of what your blood sugar has been running for the past 3 months, and it comes back as a percentage. So we want it to be under 5.6, 5.5 percentage. So that would be like if your blood sugar is running maybe 120, 130s, something around there on a daily basis, which is normal, but it's a little bit elevated. So over 5.6, 5.7, now we're pre-diabetic. So that would mean your blood sugar is running closer to 200 on a daily basis. At 6, your blood pressure is running 250, 300 on a daily basis, and then you're full-blown diabetic at that point. That doesn't mean it's not reversible. You can absolutely fix it with certain medications, diet modifications, and working out, just getting more active. So I think that's all I have to say on that topic. Does anybody have any questions about any of that? I know that was a lot of information. I kind of just wanted to touch on it because I've been looking a lot at my mom's labs. So she's been having serial labs done because we're checking her kidneys because she has those kidney stones in there. She had a kidney infection. She had sepsis. Her kidneys are already diseased because of her uncontrolled blood pressure, because of her uncontrolled diabetes. So she has had an elevated risk of dialysis or kidney failure. So those are numbers that I monitor on here quite frequently. When she was in the hospital, it was pretty bad. It was pretty bad. Her last labs I just got back and they're a lot better. So they're going in the right direction. So I had another patient who apparently was diagnosed with stage 3 kidney disease, and nobody ever told him, hey, your kidney numbers, your GFR, your BUN, your creatinine are getting out of whack. No doctor ever told him that, so he never had the opportunity to try and fix his kidneys before it got to stage 3. So now he's like stuck in stage 3. I can help him. I can help him, reduce the risk of it progressing any further, and maybe bringing it down a little bit. But it's it's important for you to know these things, so when you get your labs, you're not just looking at the numbers and it says normal in the normal range, because the normal range is completely arbitrary. So um, it's important for you to know what you're looking at and what the numbers should be. So blood work, when you get blood work done, it'll have the number of whatever it is, white blood cells, red blood cells, hemoglobin, hematocrit, whatever, and it will say normal range, normal range. So if you look at normal range of blood work values today versus normal range of blood work values 50 years ago, they're completely different. So why is that? Because normal, they take a group of the population, right, which is overall unhealthy people. So they take this group of Americans and they check their blood work, and within the 95th percentile, right? So it's all on a bell curve. So, 95% of people fall within this bell curve right here, and then there's outliers on either side, low and high. So now that's normal, right? 50 years ago, people were much healthier, and they took a group of a population of people, check their blood work, and that's normal. But they were much healthier. So those numbers compared to today are largely different. And that's especially true with hormones. You go to the doctor today, a man, you go to the doctor and you check your testosterone, it'll be 500, and they'll tell you that's normal. That's not normal. It's not normal at all. You probably feel like shit. So, or a woman, if they check your testosterone at all, because a lot of times they won't, but if they check it, you get it back and it's 15, they'll tell you that's normal. It's not normal. It's not normal at all. So my patients will tell me, "Oh, I just had labs done and everything's normal." And I'll say, "Well, can I look at them? Because my normal is different than your doctor's normal," almost always. So just for you to know a little bit of information about the numbers, so you know what you're looking at, and you can be self-aware of what some of those numbers mean and if you're at risk for certain things. So I talked a lot. There's a lot of information. I think that's all I have. I know I said that once before, but does anybody have any questions on anything? I'll be happy to answer. Going once, going twice. All right, guys. I will let you guys go. Feel free to call me at 772-207-0080. You can call me or text you. Thanks, Sam. You can call me or text me, and I'll be happy to respond. Like I said, if you have a concern about your blood pressure or you haven't had labs done in a little while, come see me. I can run a basic lab panel for 99 bucks, and we can get a basic understanding of where things are. Like I said, that's something you should be getting done yearly, especially if your family is predisposed to certain diseases. That's it, guys. Come see me, text me, call me. I'll be happy to help. So other than that, I will see you guys next Monday. Sometimes it's, so Rachel asked, is that a direct chat to you? Sometimes it's not, sometimes it is. But if you have a question specifically for me and you say, I have a question for Brooke, and you write that question out, then they will notate it. And if I don't get it personally, then they will give it to me to answer. There's a lot of messages, and I'm also seeing patients and doing all the other stuff I do, so I don't always get a chance to go through all of those. But if you have a specific question for me, they'll let me know and I can respond to that. If you're messaging me on Instagram, then I almost always get those ones on my own. All right, guys, have a great week. I hope you all had a great 4th of July, spent it with family and friends, barbecuing. I hope nobody blew their hands off. So that's always fun. So hope everybody was careful. And I will see you guys next week. Take care. We'll see you Monday.